have time for questions and answers that you've been putting forth. I'm just going to share the screen here again. This is a reminder of the talks that we had this morning. So I will have our three speakers from this morning. So far, Dr. Shung, Dr. DeMarco, and Dr. Hirsch-Renshagen. I see that you have all joined me, so great. You're ahead of the curve there. So there are a few questions here. We will try to get to some of them this morning. We have about maybe 5 to 10 minutes. So maybe I'll ask a question to Dr. DeMarco. There was a few questions about the biomarker program and how does someone get involved with it. I know you did place a slide up towards the end, but maybe you can elaborate a bit more about the study that's going on and how people can access that.
Sure. Well, thank you for the question. You can visit impactad.org for contact information. And to describe briefly, there in BC, there's actually 2 ways to get involved in the study. If you're a patient already at the clinic here at the University of British Columbia and your doctor decides that biomarkers are needed, they will ask you if you want to participate in the study. So that's one way, just part of your routine care. And the other pathway is one where there's a study across Canada and includes sites here in British Columbia, not just here in Vancouver, where it's a larger study called Compass ND, and you can enroll, and they're taking both healthy people and people with symptoms, and then you can decide if you want to participate in this lumbar puncture study as part of that larger study. And so if you go to the impactad.org website, there's contact information, and I'd be happy to follow up with you further.
Great, thank you. Maybe a question here for Dr. Shung. Somebody has asked, what is the difference between the EMERGE and ENGAGE studies?
That is a very good question. In terms of the protocol, is actually exactly the same. And for FDA approval of a drug, usually you have to have 2 phase 3 clinical trials showing the same results in order to get approval. So the 2 studies were actually designed exactly the same. The slight difference is the timing and the location. So the EMERGE study started a few months earlier, so they started recruiting maybe about 3 months earlier. So one of the argument that the Biogen say is that the people were treated earlier, so they have a longer follow-up in the EMERGE compared to the ENGAGE. But if we look at the details of the data, the ENGAGE is really not significant at all. And from my own opinion, just a few months difference is not that going to be that much of a difference. So I'm not really sure. They are also different sites, but they are in the same countries. So these are carried out mostly in North America. So Canada and United States are the main sites, but there are multiple sites in Europe as well. So it's the same countries that are carrying out the studies, but not at the same clinic. So at UBC, we were involved in the ENGAGE study, but in University of Toronto, they were involved in the EMERGE study. So they're in the same country, but not the same site. So why are they different? We don't really know, other than a few months of data collection difference. So that's a good question, and we probably need to do more studies to find that out.
Thank you, Dr. Shung. Question for our neuropathologist, Veronica. Is there any expected pattern of neurodegeneration of the brain in relation to Alzheimer's disease? For example, the back of the brain to the front, or is there any benefit in understanding this?
Yes, so classically, Alzheimer's is thought to affect the hippocampi, so the medial temporal lobe, the area where memory is first. And then neocortically, it usually by the end of life shows a diffuse pattern with posterior sparing. So the occipital lobe, which is the area that we use for seeing, is usually spared, although this can sometimes be different. depending, some patients present with a slightly atypical Alzheimer's in that regard, and then the pattern of atrophy will actually be more correlated with those symptoms. So yes, if there are clinical questions regarding symptoms and patterns of atrophy, there is interest in understanding that.
Thank you. I'm not sure who would like to answer this one. It might be Dr. Shang, but there's a few questions about the link between both hypertension and diabetes and Alzheimer's disease, and also does treatment of those conditions, particularly hypertension, have an effect on Alzheimer's disease?
Those are good questions. I don't know if Dr. Lee or Dr. For now, we'll address those later, because there is a discussion about lifestyles modification later on. So they may address that in more detail. But yes, both vascular risk factors like hypertension and diabetes are risk factors for dementia, and there's also a link to increased Alzheimer's risk as well. But exactly how the two are related is unclear. But based on epidemiology, if we decreases diabetes, lower your glucose level, and if we treat the hypertension well, then we can delay the onset of dementia. So yes, but I think maybe Dr. Lee or Dr. Fennell will talk about it a bit more later.
That's a good introduction, yes. Two questions maybe for Dr. DeMarco here. There's one to clarify about the deaccumulation versus the increase of beta amyloid in Alzheimer's disease. So maybe to clarify the link between the spinal fluid and the amyloid in the brain. What is the pattern there? And secondly, does the CSF show if the condition will get worse?
Okay, sure. Yes, it's a complicated relationship between what's happening in the brain and what's happening in cerebral spinal fluid when it comes to amyloid. So we've seen in these mornings talk a lot of great brain images where we see accumulation or clumping of amyloid beta in the brain to form these plaques during Alzheimer's disease. Now, in cerebral spinal fluid, the exact opposite happens in Alzheimer's disease. We actually lose some of this amyloid beta that's circulating in the cerebral spinal fluid. So it's thought these plaques act like sponges and recruit more of the amyloid beta that's floating around in the cerebral spinal fluid and incorporate those into the plaques so that there's actually less of it floating around as it gets recruited into the plaques. So that's why there's this lowering in CSF while there's an increase of the plaques forming in the brain. And for the second question, that was about whether or how a CSF biomarker pattern of amyloid beta and tau will show if the condition will get worse. So in this case, if you have mild symptoms and we do the testing and you're in that grouping, and remember we talked about test performance and kind of where you sit along that spectrum matters at how well we can tell whether you might have changes related to Alzheimer's disease. So let's say you have mild symptoms and you're very clearly in the region where we see people that have changes related to Alzheimer's disease in the brain. That will indicate that you have a higher likelihood that those symptoms would progress and worsen to dementia-like symptoms over time. So that's how that signature helps predict whether someone will get worse or not.
Okay. Thank you. Thank you. Finally, we'll just finish off with another question here. I've had a couple of questions coming in about sort of a gamma light or UV light therapy, maybe for our clinical trials program. Is there any plans or information about these UV light therapies that have been developed in other countries, and whether we're going to be doing any studies in that area? Maybe Dr. Shang.
Yeah, so the V-Light is very interesting, and my other hat outside of UBC is I'm also with the C5R, which is an organization across Canada to organize clinical trials in dementia. And the V-Light has applied to work with C5R. And we were reviewing the study, but because of the COVID situation, everything is put into on hold at the moment. But it's intriguing theory that somehow light shining through, I think they actually put it in your nose and it goes up to the sphenoidal area and shines some light into the brain, may actually help with amyloid accumulation. They have shown that in animals, so there's some scientific background to the science, but whether it works in human or not, we don't know. And there's a clinical trial going on. It's initiated in University of Toronto, but it's on hold because of the virus situation. But we'll hear more about it.